Hello everyone, I'm Clark Cahill, Events Manager with the South China Morning Post. Thank you all so much for joining our SCMP Conversations series event, Hong Kong versus COVID-19, Lessons Learned and Next Steps. As Hong Kong navigates a global pandemic, many international observers have noticed the progress of Hong Kong as one of the rare examples in which the spread of the virus can be minimized. Joining us today to discuss some of the key lessons that the Hong Kong medical community has learned in recent months, to discuss what we might expect in the coming months ahead, and to share insights that may help the international community around us in managing COVID-19 is Dr. C.C. Leung, Chairman of the Advisory Committee on Communicable Diseases for the Hong Kong Medical Association. Moderating today's discussion is Elizabeth Chung, SCMP Health Reporter. Before I pass things over to Elizabeth, I want to make our viewers aware that we will be accepting and strongly encouraging you to submit questions to Dr. Leung throughout the webinar. You can do so by accessing the Q&A function through the Zoom platform. Submit your question at any point throughout the webinar, and we will do our best to get your question across to Dr. Leung in the amount of time that we have. Without further ado, I'll pass things over to Elizabeth to start the discussion.
So good morning, Dr. Leung. Thank you so much for joining us here at the SCMP studio to share your insights and views on COVID-19, a really important topic that matters everyone here in Hong Kong and around the world. So first of all, to kickstart, I would like to ask a question. So what's the next step for Hong Kong? I mean, after the second wave of infections, we've seen the situation in Hong Kong has eased a bit. We have seen a single-digit increase of cases every day in the past week, and also, but then the government yesterday announced to extend the social distancing measures for another 2 more weeks. So what does it mean for Hong Kong? When could we say we could start easing those social distancing measures?
Although the second wave is largely under control, we are still having a large number of Hong Kong residents returning to Hong Kong every day, a few hundreds. And at this time, we need to tighten up our quarantine measure. So that's best, I think we need to quarantine these people in fixed hotels or in camps, so that we can test them at the end of the quarantine period to rule out any silent carrier. If any of these silent carriers manage to get into our general community, it will cause community transmission, and it may cause danger to our future control. And the other thing is the government may probably need some time to discuss with the catering sector and with other stakeholders to how to reinforce the various control measures when the government start to relax some of the restrictions. And at the same time, we need to strengthen our community screening at all the primary clinics, either in the private or public sector. This is not so much to find the cases if our control system is intact, but rather to monitor the situation, to monitor the level of community transmission. We should find very few cases in this screening if we are doing well. If we suddenly again find a lot of cases on such screening, then we understand there is problem, and then we need to strengthen all the control measures again and start over again to suppress the epidemic as soon as possible.
Dr. Leung, you mentioned that we may need to tighten the quarantine measures, but currently now actually for all air travelers, returnees, they are actually given a second specimen bottle to test on the saliva sample on the 12th day. Isn't this measure sufficient enough?
It is a definite improvement, but it still cannot avoid the problem of the returnee becoming a silent carrier during the middle of the quarantine period. They can pass the virus to their family members, and their family members can bring it into our community. There is still a loophole there. To close this loophole, it's important to quarantine this patient in a safer place. Home is not a safe place for this pandemic because the virus is known to spread within family. In fact, most of the clusters seen in mainland China, in Wuhan and in other cities, are within the families. And we also see a lot of clustering within our families. And in fact, about 25% of our local cases, 25% of all the cases in Hong Kong are in clusters. Many of them are within families. So that we should not rely on our homes to isolate all cases or to quarantine their contacts. Such strategy have not been shown to work in Europe or in the United States. Isolating the patient at home cannot stop the spread of the epidemic.
But do you think that in Hong Kong we have that enough capacity of quarantine facilities to hold all these returnees?
We have a lot of empty hotels. If the government can talk with more of the hotel operators to see whether they are willing, I think, to lend their hotel to our government and or to provide service to our government, we can have enough accommodation for all these people returning to Hong Kong. In fact, some of our hotels are doing it on their own. A lot of students, after they return from Europe or from UK or from USA, they stay in the hotels rather than going home.
Moving a bit on the experience of Hong Kong, I mean, our infection rate is relatively lower than some of the other countries. So far, we have recorded 1,029 confirmed cases in around 3 months' time. So how would you compare this growth rate with those of some other places, and what has Hong Kong done differently in containing the spread of the virus?
I think there's only one key to our success. We acted early enough before our healthcare system is overwhelmed. And why we managed to do that? Because the Hong Kong response have always been a citizen-led response. The government anywhere often have too many things to think about, but citizens can react immediately. After we noticed the outbreak in Wuhan, most of the Hong Kong people voluntarily stay at home whenever possible, and when we went out, we all put on a mask. That is a really good method of source control. Although people in other parts of the world did not understand that, the source control is probably the most important thing to decrease the infectivity of this virus, because it may spread mainly by droplet or by droplet contamination of other fomites. If you can seal off practically all the droplets by putting anything from a mask to a face cover near our mouth, it stops the contamination. The virus cannot spread if you can stop it from coming out from our mouth and nose.
But moving a bit forward, I mean, the health authorities have been warning the public that there could be a resurgence of another wave of infections in Hong Kong. But then in Hong Kong, we have all these stringent border restrictive measures, social distancing measures. We're doing quarantine and isolation and testing. So how is it possible that another wave of infections could still hit Hong Kong? Like, what other factors could affect us to see if there's a possible surge of infections?
Because nowadays we recognize that the asymptomatic or silent carriers probably constitute the majority rather than the minority of patients. And if we cannot stop this silent carrier from going into our general community after they return from the epidemic zones in Europe or in USA, that may cause silent transmission within our community in case some of them get into our healthcare, our hospitals, our OH homes, our prisons, or our discipline forces. That can trigger off a major outbreak. I think we saw these outbreaks in many parts of the world. For example, in Toronto, they have a lot of outbreaks, I think, in prisons and in OH homes. And even in the United States, they have a lot of problems, I think, related to OH homes. Hong Kong is not immune, although we are we did very well because we started early to stop visitors to the OH home. We strengthened up all the preventive measures there, and we helped to prevent any outbreak in the OH home up till this moment. But we still be on high alert to protect all these vulnerable areas. Every city or every places have their own vulnerable points. We need to look at what are the vulnerable points in Hong Kong so that we can take proper action to stop all, to close all these possible loopholes to prevent another major wave.
So this infection could actually be last for maybe around 1 to 2 years, and it is indeed like a protracted war. Do you have any tips for the public on what they could do, to avoid any, social distancing measures fatigue?
In fact, we need to use a strategy, what we call we suppress and then relax. If we see an imminent danger through our community screening or community surveillance, for example, if we find a lot of increasing number of cases from the community, from, for example, less than 1 in 1,000 to say close to 1 in 100, and then this is a very important danger signal. In that case, we need to tighten up all the control measures again, and we cannot keep on some of these social distance measures, especially the more extreme one, for too long, without harming our economy. In fact, no economy in the world can stand prolonged period of lockdown, and that is the reason why many citizens in different parts of the world, especially in Europe or in the United States, they are calling for relaxation. Because I think after prolonged lockdown, I think a lot of people lost jobs and the economy cannot survive.
I'd like to move on to testing. I mean, now we're already asking all air travelers who are coming back to Hong Kong to submit their different saliva samples, and also for another one on the 12th day. And then also starting from today, basically everyone who come back to Hong Kong, they will need to stay in a specific locations to wait for the test results. But what can we do more to step up the testing capacity or screening to identify more patients? Do you advise like other countries to do something similar as well?
Testing have an important role, but it only works after you control those community transmission with unclear links. Otherwise, you don't know who to test. For example, in Hong Kong, we have over 7 million population, and if it's not uncommon for any one of us have 2 episodes of upper respiratory infection every year, and we may have sore throat or sneezing, and if we all go for testing, that means we need to do 40,000 tests each day. It's impossible to test that, and so that we can only test those who are at risk. For example, for those returning travelers, we need to test them, and so that we will not allow, I think, any silent carrier going into a community. And at the community level, it's mainly for the surveillance, so that we can monitor community transmission. But in all the high-risk institutions, in hospital, in OH home, we need to test everyone symptomatic, so that we can pick up these cases early and isolate them to prevent institutional outbreaks. It's an important area, and if we do it too late, before I think it spread all around our institution, it will be a very difficult job to contain it.
So did you advise other countries to follow suit on what Hong Kong is doing as well in terms of screening?
Yes, I think it's important. But first of all, control the community transmission first by some social distancing measure, voluntarily based, and with the mask as source control, so that you can contain the epidemic down to, for example, 1/10 of your maximum level, so that you can safely resume your most parts of your economy with the protection of a mask, and then step up screening for any cluster you notice, for any case inside the institutions, and if you detect any case, you need to do contact tracing to try to stem them all these clusters out as soon as possible, so that you can maintain control. But this testing strategy only works after you control the community transmission with some means. Otherwise, you won't have sufficient test kit to test everyone. Just what I mentioned. We can't have sufficient test kit to test 7 million people every day.
Thank you very much, Dr. Leung. So we would like to pick some questions from our online audience. So we'll pass, Clark, you may have some of those questions, and we'll pass the time to Clark.
Yeah, we have a question here from Eliana Goldberstein. I'm a scientist from New Zealand. I would like to know more about the treatments and clinical management you guys have implemented, as your mortality rate remains very low when compared to other countries of the world.
Dr. Leung, what do you think?
Yes, in fact, we don't have any secret to tell. Because of the treatment, it's still mainly supportive. We are trying, I think, all these antiviral drugs, but we have too few of the severe cases to tell experience what worked better than the others. The low mortality in Hong Kong is mainly because we acted early so that our healthcare system is intact, and we managed to prevent outbreaks in our old age homes, so that only 15% of our patients are aged 60 or over. In contrast, the majority of the patients admitted in other countries, they are over 60. They're quite different because we are facing a different situation. Most of our patients have only very mild form of diseases. They account for the low mortality we observe. We dare not say that we know anything more, I think, on the treatment of these critical patients than the more severely affected areas. And in fact, we don't hope to see that anyway. And so that we cannot offer, I think, any experience in that area. But however, we need to put a lot of caution in the sense that people all over the world are testing everything. But because this disease is a very variable cause, unless you do it properly, either in randomized control trial or with very stringent protocol in compassionate treatment, it's very difficult to know, I think, whether a regimen works or not. Because it could all be chance. Because you are testing everything, they might, I think some study may one day find that there may be some effect, but you really don't know whether the patient will recover, even without your treatment.
Okay, Dr. Leung, we have one more question from the audience here from Rohit Nayar. Dr. Leung, please share your views on whether such quarantine facilities should be outside the city rather than on the inside parts. This question is related to kitchens and particularly sanitary facilities being linked to the city systems per reports that feces may house the COVID-19 for a long period of time.
Up to this moment, we do not have clear evidence linking, I think, all these fecal contamination to outbreaks anywhere or to any fecal oral transmission. As long as you have proper sewage systems in the city, I don't think it's absolutely necessary for us to have any quarantine facility outside the city. But of course, it's up to different countries, different cities to decide what is the best course of action, because we are facing some unknowns here. The virus is there, but it seems that it's not the key driver for transmission anyway. And for those under quarantine, it's important that whenever they develop symptoms, they are tested and then separately isolated to avoid cross transmission among people under quarantine. Otherwise, some people under quarantine they might not have the infections to start off with just because of cross contamination. You get a lot of people getting the infection, then it increases the workload in handling all these patients.
Dr. Lau, I would like to carry on our discussion on COVID-19 and now move to a bit more medical side of the virus. I mean, one of the features we see on COVID-19 is that there are quite a lot of people who have mild symptoms, or some of them even do not have any symptoms. And I mean, in our past research, we saw that in Hong Kong, around 18% of the COVID-19 patients here, they are asymptomatic. So how would you comment on this proportion of asymptomatic patients when compared to patients who have other strains of coronaviruses or other kinds of infectious diseases? Is it particularly higher than any other strains?
Subclinical infection is not rare for viral infection. In fact, for some viruses, the vast majority may be subclinical. Japanese encephalitis is a key example. And even for influenza, many influenza cases are not symptomatic. And for coronaviruses, especially for SARS and MERS, these severe ones, the subclinical case or asymptomatic case are less common. But for this virus, for the COVID-19, the subclinical infection is a major. This subclinical, we do not know the exact. Up to this moment, we do not know the exact proportion of subclinical infections for COVID-19. But preliminary data from an Italian village suggests that they might be the majority rather than the minority. Data recently from the surveillance in mainland China also show that we have larger number of cases without symptoms than those who are symptomatic. And so that we need to wait for large-scale surveys. Some of them are going to take place in Wuhan and other Chinese provinces to know exact proportion of cases that are without symptoms. And that's important. If we have a lot of what we call subclinical infection or asymptomatic cases, it causes concern over these silent carriers and the transmission. But it also means that the herd immunity may build up more quickly than we suppose. And then the epidemic may start to level off earlier. And we may have a larger convalescence power to call upon in the more severely affected European city and in the United States. But up till now, we are not certain, because even at the current reported way, most of the countries, severely affected countries, only have about 1 to 4 per thousand of their population having been infected with COVID-19. And even if you multiply by 2, or it's still 1%, that means the herd immunity is far from enough to stop the spread of the epidemic. And it's still a long way to go to wait for the herd immunity. And we still need to wait for effective vaccine or wait for effective treatment before we can be more reassured that we can have a better control of the pandemic.
You mentioned the term herd immunity, and in fact, actually, it has been quite a popular discussion a few weeks back then. In Hong Kong, how could we know whether we have achieved herd immunity? Is an antibody study the only way to do so?
In Hong Kong, we do not. I believe that we do not have sufficient amounts of infection happening in Hong Kong to expect any degree of herd immunity up to this moment. And we need to wait for result in the severely affected city of Wuhan to estimate what is the likely proportion of the individual or proportion of silent carrier within a community. But the silent carrier issue is an issue, but this silent carrier, the virus will also clear with time. So that what we need to bother about is the current level of silent carriers and the future ones. Not those could have been months ago, because most of them, their virus should have been cleared.
But then looking forward, I mean, now we are waiting for vaccines. Scientists around the world, they're racing against the clock to develop vaccines. But then, well, we were told that actually the vaccines may not be available until the middle of next year. That is the earliest estimation. So before vaccine is made widely available, is it any chance that international travel could be safe for us? Are there any tips for us that whether we could still go for international travel?
It's difficult unless the pandemic is under control in more places. Up to now, the pandemic is under control mainly in a few areas, especially I think in the Greater China area. We are still lucky. In Korea, it's still okay. But in many other cities, we are not certain. Either they have reported quite a number of cases, or they have not done enough testing, so that we are not certain. If we are going to resume international travel, we need to assess, I think, the epidemic in those places we want to visit first. If the epidemic is under control, it may be safe to resume some of the mutual travel, but we need to wait. If we have effective treatment, and then we may offer hope that we may be able to resume some of this travel earlier. Because if you can treat this disease very effectively, and there's not so much to worry. The problem now is these patients are very difficult to manage for those requiring oxygen support and intensive care. And it is really testing our healthcare system. And if we have effective treatment, it will greatly reduce the burden in our intensive care unit. In that case, then, even if there is some minor scale degree outbreak, we are not so worried, because we can contain it quite quickly. But we need to wait, because up to this moment, some of the drugs may be showing some effect, but none of them can work like a miracle up to this moment. So that we need to wait. Maybe we need to wait for the development of new drug, specifically target for this virus.
But how long do we need to wait? I mean, now in Hong Kong, we are testing on mainly 3 types of medications in treating COVID-19. How do you assess the efficacy?
There's a global effort in minimum control trial, testing those drugs under development and also those repurposed drugs. But it's still too early to say whether any of one of them work well. Some of them may have some effect, but for viral infection, we are less advanced than treating bacterial infection. And the treatment of viral infection, usually you need to give the drug quite early, and the effect may not be so dramatic compared to treating bacterial infection. And if we can have very specific drug targeting the new virus, it may increase its efficacy. But the development of drugs and its clinical trial take a very long time. And if we are fortunate that some of the existing drugs can work, and then we will get treatment earlier. If that is not the case, we may have to wait even longer than the vaccine.
I'd like to move on to ask a bit about the traces of virus found in recovered patients. I mean, 2 days ago, we saw a similar case in Hong Kong, a recovered patient, and then his body was found with traces of virus, and then he was tested positive again. What does it mean? Is it a worry to us?
It is a well-reported phenomena. Somehow, some patients carry the virus for quite a long time, some of them over a month. And for our sampling, we usually only sample the upper respiratory tract of these patients. And in Hong Kong, we need 2 laboratory tests 24 hours apart before we say that the virus has been cleared. And the patient should also have definite clinical recovery before we discharge the patient. But it does not rule out that the virus may still persist somewhere in the body, for example, in the lower respiratory tract or on the gut epithelium. And it's difficult to tell. And this persistent detection of the virus among those who have been discharged have been reported, for example, in Korea, in other places. Some of them could be dead viruses, but we are not certain, because even if you cannot culture them, it does not mean that the virus is not viable, because the culture only have limited sensitivity. And the other thing, if the patient who have recovered again develop symptom again, and you can also detect the viral signature by the PCR, then there is good reason to believe that the virus is multiplying. That means it is viable. And some of these patients have been found in other places. Although the case we found in Hong Kong was said to be asymptomatic, in fact, we are not certain. But we believe that the infectivity should be low, because the viral load was said to be low because of the cycling time.
Moving a bit to the international aspect, I mean, the United States last week, they said that they decided to discontinue funding for the World Health Organization. I mean, in your view, what points, are there any serious ramifications for such decision, especially when we're at the time of battling the pandemic?
Yes, it's unfortunate. It's unfortunate, and it is a once-a-century crisis. And although we can all criticize the World Health Organization, or indeed any government, for any shortfalls, but we still need to ensure that they deliver in this battle against an unprecedented challenge, I think, in this generation. And if we cut all the funding, there will be problem, I think, in the control of the disease in many countries, especially those low and middle income countries. Furthermore, this pandemic have a major effect on the global economy, and food shortage and economic breakdown will have grave consequences. So it's very important that the WHO have to maintain its leadership in this important battle. And we do hope that the relevant authorities should reconsider whether, I think, they should temporarily, at least, I think, put aside all these different finger pointing or arguments that look at the problem ahead. We need to fight together. Otherwise, ultimately, all of us will be losers. The virus will not respect any national border. And if we cannot continue all together, we will lose the war altogether.
But what serious consequences would you foresee if there is a cut of funding for WHO?
We
in
still
particular?
need to work on many fronts. We need to help those low and middle countries contain the epidemic, to minimize the loss of life, and to minimize suffering and the breakdown in the economy. We also need to coordinate the development of vaccine and drug all over the world so that we can contain the pandemic early enough before the global economy collapse. Even if the global economy collapse, no one will be immune. Even those in the United States, they will suffer.
Looking a few years ahead, when maybe the time when COVID-19 has been really put under control, are there any tips or ways that we could prevent a pandemic at such large scale?
In fact, human beings are not the sole inhabitants of this planet. There are lots of viruses in wild animals, and they are constantly mutating. And our urbanization and modern transport add to the pandemic risk. Although banning all the wild animal sale and banning the consumption of wild animal products will help to reduce the contact with animal and risk of some of the virus jumping from animal to human, it cannot eliminate altogether. Just take the example of the influenza. I think you have the influenza pandemic after in the space of few decades, and we need to, besides all this banning, we need to rethink some of our system, how to allow a more effective global surveillance system to detect any of these zoonotic outbreak early, so that we can coordinate global effort to contain them as early as possible. And this will give us the greatest chance of containing this epidemic and to prevent them to turn into a pandemic like this one.
You mentioned about stepping up the global surveillance on zoonotic diseases in Hong Kong. What is our role and what we can do better in terms of this kind of surveillance system?
In fact, we need to do it all together. We can't do it in a single case. In fact, we need to do it all over the world. If we notice unusual outbreaks, we need to share the information as early as possible, and we need to work together to see what is the risk of transmission and assess the pandemic potential and other things. And the WHO have a key role over there and should maintain that role as far as possible.
Thank you very much, Dr. Leung. I'll pass the time back to Clark, who is going to give us a bit more questions from the audience.
Thanks. So we have another question here from Rohit Nayar. Dr. Leung, do you know, is the hospital authority carrying out test checks, say after a week, for patients discharged and that have recovered after being positive? Case in point being Korea, reporting reinfection positive cases after 21 days, and that too after being 2 consecutive negatives.
I think they are looking. We are looking at this issue, and now in our patient, they after 14 days of medical surveillance at home, they are being followed up in the hospital authority, and some of them will be rechecked for the viruses, and those with symptoms, of course, will be rechecked. But whether we need to extend that further beyond 14 days is a key question, and that also occur. They also apply for quarantine, post-quarantine issue, because some people under quarantine for 14 days and discharge, test negative and discharge, and some of them have been reported to develop disease after a negative test. And there may be a need to consider whether we need to extend the period further, especially if we can contain the local transmission, if we can have sufficient resources. There may be a point of retesting some of them or put them for medical surveillance for another 7 days.
But do you see a need at this moment to extend the quarantine period now we're using 14 days as the standard?
Not for the moment. We need to at least tighten our current quarantine first. We still cannot find a satisfactory of quarantine these patients for 14 days. It's premature to talk about 21 days because we allow quarantine them at home, which I mentioned that is not a safe phase. And unless we can solve that question, and then we can think about whether we need to improve it further. Because it all depend on your available resources, how you can manage it. If you propose something that you don't have resources or you don't have manpower to manage it, I think it's bound to be futile.
Thanks, Dr. Leung.
Okay, we have another question. Before I ask another question to Dr. Leung, I want to acknowledge that we're aware there's been a few audio issues with the webinar. I just want to make our viewers aware that after this finishes, we'll be distributing a recording of the webinar to everyone in which those audio issues should be fixed. So please do be aware of that. But the next question here, this is from Lawrence Tam. Dr. Leung, do you think that the virus will die down with the rise of temperature, say 26 degrees Celsius or higher? If yes, how do you explain the widespread confirmed cases in Singapore?
I have good reason to believe from the laboratory data that the viral viability may decrease slightly with a rise in temperature. But at the current, I think, temperature range in our northern summer, up to, for example, 34 degrees Celsius, it may not be sufficient to attenuate the virus sufficiently enough. Because we don't have any herd immunity for this virus, the effective viral number is still expected to be 2 to 3 unless you have other measures to suppress it. And even if the virus, the period of survival in the virus is slightly decreased, it's not sufficient to bring down the effective reproductive number to a level close to 1. And so that I do not expect that the virus will die down in summer. And the data from, as mentioned by our audience, we are seeing the spread of the virus in our tropical region, where the temperature is at least in the 30s. And so that there's no good reason to believe that our hot summer will save us. And it's quite different from seasonal influenza. With seasonal influenza, they only have a effective reproductive number very close to 1. So there's a change in environmental temperature may affect the effective number slightly, and if they manage to bring it slightly above 1, you get the winter flu season. If you bring it down, and then the winter season disappear. But it will be a completely different story with COVID-19. Mainly, the main reason is we do not have any herd immunity in most places. Of course, another thing which we need to think about is the survival of the virus outside the human body is reported to be a few times longer than the influenza virus. And that is also a key reason that I believe that we will not go in our summer.
Okay, another question here. This one from Rocky Mendez. In conjunction with the New Zealand scientist question, have you developed, or has Hong Kong developed, a protocol for treatment, or do you go case by case? Also, with regard to business operations, what would you encourage, for example, for retailers?
The first question is we have been doing clinical trials or some of these drugs, and there will be other clinical trials being planned. And the only issue we are facing now is it may be difficult to recruit sufficient number of patients for clinical trial if we can contain the epidemic. It is the same in mainland China now, because most of the cities they are seeing fewer and fewer patients, and we do have a protocol in different hospitals for managing these patients and in the hospital authority, but there is no as yet, I think no regimen that have been found to be definitely very effective in treating COVID-19, and supportive treatment is still the key to improve patient survival.
So what happens if we do not have sufficient amount of patients to go into clinical trials to test drugs?
This is a global. We need to be part of the global level for clinical trial. We alone may not have sufficient number of patients to adequately test some of these regimens, because the disease course is so variable, and you won't be able to tell what exactly this patient will the outcome of any patient, unless you need a very big group to detect a mild effect. Unless you have a very good drug that can, for example, cure the patient within a few days, or you have a large group of patients. Otherwise, you won't be able to tell the difference. And the only hope, I think, is for multi-center trial, international cooperation. Indeed, Hong Kong have been involved, I think, in the testing of a new drug here, when a global trial there.
Okay, one more question here from Dr. Neil Campbell in the United States. What's the impact on patients who have experienced cardiovascular or kidney problems?
In fact, I am not an expert in that area. Probably leave that question to our colleagues, I think, who are battling, I think, the COVID-19 in the intensive care unit.
Okay, one final question here. This one's from Anonymous. Is there any chance that COVID-19 could disappear in the way that SARS disappeared?
Although we all hope so, it is most unlikely, because the problem with this virus is the symptoms are so non-specific, and there may be quite a number of silent carriers that our conventional contained strategy of early case finding and contact quarantine cannot effectively contain it, reduce its effective reproductive number. And so that we need to depend on either lockdown or some social distancing measure coupled with source control by wearing a mask or face cover to control the community caused transmission before we can rely on our usual containment strategy of case finding and quarantine and contact quarantine to tackle the remaining clusters. And with that in mind, it's unlikely that we will be able to contain this virus before we have an effective vaccine. And the other question is, the other issue is, we cannot tell whether we cannot be certain whether the virus may manage to persist in some form in some of the patients, or whether it can persist by spreading from from population to population, so that the virus become pandemic in our population. It's likely that with the current development, with the large number of cases found all over the world, the virus will have a sufficient opportunity to adapt further to the human population to become endemic. And whether it becomes seasonal, we need to wait and see. But there is a good chance that the virus may become endemic because it's already running wild in many countries.
But does it mean that we're going to live with the virus before a vaccine is made available then?
If we cannot stop it, and then either we contain it and then guard against importation, just like in a situation like Hong Kong, or in other places, the virus is spreading and let the herd immunity build up, and with loss of many lives, and with problem in the economy, and then one day after herd immunity build up, for example in 3 or 4 years, and then we will become an endemic diseases with much lower morbidity and mortality.
Mm-hmm. Do you have any tips for the general public on how could we live with this virus before vaccine is made available, before we achieved herd immunity?
In Hong Kong, we need to guard against importation. And then if we notice any sign of viral transmission intensifying within our community, we need to step up all the containment measures again. And we hope to resume most of our essential economic activity as much as possible, especially we are a market economy. We cannot shut down all these recreational facilities and other things for too long time. If we can bring the local spread under control, we can superly relax them, and then intensify our monitoring at the primary care level. Whenever we notice any sign, we step up the containment again. And this is we suppress and relax, suppress and relax. And then until one day we have an effective vaccine, and then we can try to immunize groups by group, depending on the availability of vaccine. And when the vaccine is when there's plenty of vaccines, we can immunize the whole population.
Mm. That means that we have to stay at high alert at any time before the vaccine comes in.
Yes, we need to strengthen the quarantine measure, and then we need to monitor the community transmission with screening in the private clinics, and we need to at least try to minimize unnecessary social contact as much as possible, and always wear a mask when we go out, at least till the pandemic is done in most of parts of the world.
Mm. So thank you so much for your time and your expertise to this webinar, Dr. Leung. I think this is all we have. So before we go, I'll pass it back to Clark, who has some information on how our viewers can join us again at an upcoming SCMP virtual event.
Thanks, Elizabeth. And I'll also just echo Elizabeth's sentiments. Thank you so much for being with us today, Dr. Leung, for sharing your time and insights. We very much appreciate that. We hope you guys enjoyed today's webinar, and we hope you'll join us again for future webinars and virtual events. One event in particular that everyone should add to their calendar is our 2-day China Conference Hong Kong, which will be hosted 100% virtually for the first time ever on May 14th and 15th. The China Conference Hong Kong will include panel discussions and interviews that will dive deep into the latest public health situation in the city, as well as those that will closely examine the economic impact that COVID-19 has had on Hong Kong's key industries, including retail, tourism, and real estate. You can register your spot to access the conference by scanning the QR code that you see on the screen or by visiting chinaconference.hk. I just want to acknowledge one more time and let our viewers know that we are aware of the audio issues that happened during this webinar, but we will be distributing a recording of the webinar afterward in which these issues should be fixed. So please be on the lookout for that. On behalf of the South China Morning Post, thank you again for joining us, and we look forward to seeing you next time.